Hi there and welcome to your Take 10 tutorial about the lateral line. So we talked a little bit in one of our previous tutorials about the superficial back line and the superficial front line. So we're going to discuss the lateral line today. Now, as per the other myofascial lines, what we're discussing is a series of muscles and soft tissues, including fascia, which help to support and stabilise through our body in various different ways. When we're discussing the lateral line, and as you can see, baby Ralph is going to demonstrate, not that he has muscles unfortunately, that the lateral line starts or begins depending which end of the body you begin at. But I'll start at the foot, and it comprises of all the tissues that sit on the outer aspect of the foot, so the little toe side of the foot, and then upwards through the outer aspect of the lower leg, and then up through the lateral side of the thigh, so the outer thigh, through the gluteals around the buttock at the pelvis level, and then it continues upwards through the obliques, so that's the part that fills the gap between the pelvis and the rib cage, over the rib cage itself, and then upwards through to the side of the neck. So I'm just going to demonstrate that again, but on me. So in terms of the lateral line, we'd be looking at the tissues from the outer aspect of the foot, all the way up the outer aspects of the lower leg, and then up through the side of the thigh, around the buttock area, through the side of the waist, up through the rib cage, and then it continues upwards through to the side of the neck. So the lateral line is really important. It's one of our favourites at Plus Health Company because we recognise the relevance it has in terms of our function, movement and overall feeling of control and comfort. So we're not just discussing the gluteal muscles when we're looking at the lateral line, and hopefully that has just demonstrated that there's more to it. What it might explain is why, for example, you may present with an overworking sense of tension around your neck, but there is no specific neck issue besides. So we might assess your neck, for example, and look at your movement and ask you to move in various directions and how that feels, and it might feel okay. It may be that you feel the tension at times where, for example, you may be working with abdominally focused exercises, or if you're doing something that feels quite challenging to the body laid on your side. And this is really about the neck part of the lateral line ramping up its volume to try to compensate for some loss or some discrepancy, lack of activity lower down the lateral line. So in order to address any overworking tension through the neck, for example, we need to start to look lower down the lateral line to try and understand why that may be developing in the first place. Now, commonly, we are generally a little bit underactive and a bit less strong than we could and should be around our abdominal zone. Now, in the case of the lateral line, we're not talking about the six-pack tummy muscle that sits at the front of our torso, but with the lateral line we're talking about the obliques, and they sit a little bit nearer towards the side of the waist. They're the muscles that help to keep us orientated in the middle, so we don't list to one side because of an overpull on one side and a weakness through the other side. They also are the muscles that rotate and twist us. So if we've ever had a period of time where we've been less active with our abdominal muscles, for example in the case of having had a child, then you may have not properly kept up to re-strengthening in that area, and it may lead you to feel weaker in the longer term, which of course can then have implications down the line. So it's important that we consider your oblique component when we're thinking about the lateral line, strengthening it, and where perhaps you may be overworking. Then of course the next part would be to consider the gluteals. Now, it's often the case that our buttock muscles are also a little bit depleted on the strength and endurance front, and that can be partly attributed to the fact that we sit for so much more of our lives now, so lots of jobs are in seated positions, we sit for lots of our hobbies and activities, and we've been generally less active sitting on our buttock muscles, which is not a way to activate them. So strengthening around our hip can also help increase the length and strength and balance of the lateral line. But what we must consider is that the buttock muscles need to be strong and have good endurance in order to influence the lower limb in a positive way as well. So if we continue down onto the outer aspect of the thigh, this might be a place where you commonly feel to work when you're doing what ought to be a buttock focused exercise. Now in class, when we're face to face, of course what we'll do is correct you from a tactile perspective, so put our hands on and help you to get the right position. A little less easy remotely, but the thing to really bear in mind is that if you're doing an exercise to strengthen your buttock muscles, then it should be in your buttocks that you feel it. And unfortunately, buttocks are larger than we sometimes like to think they are, but anything from that knobbly bone at the side of the hip backwards over the buttock, towards the crease of the buttock, up towards the start of the lower back, and towards the bit where we go in towards the start of the upper thigh. That's all buttock, folks. We've got several muscles in there and they all perform a slightly different role. Some turn the leg outwards, some turn it inwards, some take it to the side, some take it behind. So it's important we know which of the buttock muscles we need to do more with. If we're not feeling the work in the buttock and we're feeling it more into the thigh, then we're probably increasing the volume in a tissue called tensor fascia lata and the iliotibial band. They are abbreviated to TFL and ITB because it's a bit of a tricky mouthful, but also to spell. So the tensor fascia lata sits at the outer aspect of the hip, and then it descends into the iliotibial band, which inserts around the outer aspect of your knee. And it is a taut band, so it's a very strong tissue, and if over a period of time you've become overactive in that area, then it's quite easy to work the area next time you practice and quite difficult to tap into the buttock muscles themselves. So sometimes it's about releasing that tissue, using a foam roller, using a spiky ball, having some soft tissue release with us in clinic, and that will help you to re-establish some activity around the hip a little bit more favourably. Then we also need to consider the outer aspect of the lower leg into the foot. Now these areas tend to work together, and what we need to think about is that the calf muscle that we can see and feel in our lower leg is not the only muscle in the lower leg. We've got lots of other muscles and tendons that sit underneath it to help to stabilise the ankle and the foot. Now the muscles on the outer aspects of the foot and ankle turn the length of the foot outwards, they evert it. So rather than the soles of the feet coming together, it moves the soles of the feet to turn away from each other. If you've had a history of ankle problems or foot problems, and you notice that your balance is a little bit wobbly, then it could be that actually what we need to do is really focus on improving your balance so that you can alleviate any overworking and tension that you're feeling upwards in the chain. So in theory, you could have a history of having had an ankle problem that you didn't fully work on, it didn't totally get better, and then develop tension in your neck over the course of months and years. So it's our job to help play detective really, to understand why it is that you're presenting with these issues. And of course, the lateral line is not the only line of tissues that we consider, so we have to think about the other elements as well. So the lateral line has a real relevance when it comes to thinking about how a person is feeling. And it's important that we address any imbalance so that you can get better. I quite like the analogy that the pain isn't always where the problem is, because we can, as the saying goes, it's the culprit that stays quiet and the victim that shouts out. So it's just again giving and reiterating the idea that we don't necessarily feel the pain where the problem is stemming from, which it can be why, and it's quite a hard sell sometimes in physiotherapy clinics, that we're giving you exercises to help strengthen your foot and ankle with balance focused activities, or perhaps your buttocks or your tummy in order to get your neck feeling better. We don't always need to treat the neck. In fact, it can be quite a short-term relief. So if you're somebody who keeps going back for neck and shoulder massages, or manual therapy in things like physio clinics, and it's not really staying better in the longer term, then my suggestion would be that we start to explore somewhere else in the body to see if we can make a clinical view on why that is happening. So, the lateral line. Now, I just thought it would be useful to teach a couple of little exercises that you can be working on to help each portion of that line. It's a very simple introduction, it's by no means the whole thing, but to start with, it would be a case of trying to do things like balance on one leg. So you know that we like that in class. We always incorporate some element focused on balance. But standing on one leg, perhaps with toe touch support on the other side, and working with support at the kitchen worktop or the bathroom sink or a high windowsill, just to stabilise you a little bit. But the more you work on challenging your balance, the more you will strengthen and improve the little balance receptors that sit within the ankles and the knees specifically to help you balance better. Now, a byproduct of better balance, and also a way to achieve better balance, so it works both ways, chicken and egg, is actually to be stronger around the buttocks. So we're not really ever going to actively strengthen the outer thigh, the iliotibial band. That will do it all on its own. We don't need to help it with that. We need to focus a little bit more on the buttocks. And something you won't be able to tell from this video here is quite how I'm doing this right now. But to describe it to you, whether you're sat, stood, laid on your back or laid on your front, put your hands on your buttocks. And when your hands are on your buttocks, I'd like you to squeeze your buttock muscles together. So you're squeezing them, you're making them taut, and then release your buttock muscles to follow. And what you're wanting to do is feel like you're doing that with a volume switch. Rather than switching on and off, you want to feel like you're increasing volume and then reducing volume until you're back to silent. You're not contracting the muscles anymore. Quite commonly, people find it a bit tricky to do it in one or two positions. So try other positions to see if you can get a sense of what to do. And when you can do that, you're really listening out, pardon the hands, for the fact that you're able to work them symmetrically. So you're not finding that one's really good at activating and releasing, but the other one sort of just drops off. They need to be able to work together like a conductor conducting music. Now, when you can do that with both buttocks together, you're then going to try working one buttock in isolation. So keep one buttock relaxed and the other one really working up through the contraction and then releasing back to zero contraction, so a relaxed state. And you would try that again. Commonly, people will find that rather than being able to control the release, the muscle just sort of lets go. So until you can really well work both buttocks together evenly and smoothly, and then one buttock at a time, evenly and slowly, it's a really good exercise to practice. Also, when you're standing and you're balancing on one leg, make sure that you do feel awareness of your pelvis. So we don't want to be hitching or sinking at all. We really want to keep the bubble in the middle of the spirit level, the pelvic bucket steady, all that imagery we typically use, so that we're able to recruit the buttock muscles as a means of helping to stabilize us through our leg. Now, once we've started to think about the contracting element of our buttock muscles, then we can also think about other exercises. Now, more often than not, we do these on our side because we're experiencing this through the lateral line. So when you lie on your side, as you'll know from classes, no doubt, you can either position a folded towel between your ear and your shoulder with your arm lengthened above you. That's not comfortable, you can position your arm in front and get a thicker cushion or a bigger rolled up towel and position that under your ear there. It doesn't matter, it makes no difference to the exercises. Now, because what we're doing is wanting to help reduce or minimise tension through our neck, then what I'd like you to think about is, if you glance in a mirror or if you're able to get somebody else to tell you, that your head and your neck is orientated in the center line of your torso. So if you have too much support and your head is quite elevated, that will take you out of the midline. And conversely, if you're not using any support, that will also take you out the midline, neither of which are where we want to be. Now, the muscles through the side of the neck also link up with the top of the shoulder. So when you're supporting through the arm, we really want to consider this sense of lengthening through the neck, not depressing the shoulder downwards, but just making sure it's not rising upwards and we're feeling wide across our collarbone. Light support in the hand wherever possible, but when your muscles start to feel that they're being challenged and quite tired perhaps, lower down the kinetic chain, then you might start to find your shoulder rising. That may also coincide with any tension you might feel around your neck, and those two things are linked because of course this is happening as a means of trying to overcompensate for a weakness lower down. Now the other place to consider is our waist. So if you have a relatively small waist to the hips, then you'll naturally sink downwards. But what we need to do is to really maintain that midline again. So for most of us, there will be a little space under the lower waist running up towards the lower aspect of our rib cage, which we're able to maintain. If we can maintain that as we do various movements with our leg, then we know that we're able to separate the action around our torso from our leg and hip, which is absolutely what we should be able to do. So lengthening through the lower waist as if we're visualising, we've got a little mouse house space under there. We're creating a ray of light under our waist to maintain that space and that sense of lengthening the upper side of our hip downwards and away from the rib cage. Now, when we're stacking our pelvis, it might be nice to think about your hip headlamps being forwards facing rather than reclining back. So you need to feel that you really are stacked one half of the pelvis directly on top of the other. And if you do have lots of overworking through the outer aspect of your thigh, well then the thing to do is to lean more forwards. So you're lifting perhaps then through the feet a little bit, or at least on the upper leg, to really get a sense of being slightly tilted ahead, and in doing so that can tuning the buttock muscles from behind. Now when we've worked through the buttock muscles with our various exercises such as clam, such as lift and lower, side leg circle, side kick, all of these favourites of ours, it's really important that you can keep the pelvis steady, the torso and the waist nice and steady, and as relaxed as possible through the shoulder and the neck itself. If you start to feel tension in the neck and the shoulder, think about whether it is that you've been working hard lower down the kinetic chain and that perhaps that might be why. It's better to stop when you start to feel other areas compensating if you cannot address it through a change of your position and perhaps enhancing your technique, because otherwise you just compound that and it becomes very much a habit, a learned behaviour for your body, and then it's harder to correct and change in time to come. So they're the sorts of exercises you might like to work on for the gluteal aspect of the lateral line. And then, and not always a favourite for people, but one of ours is that side bend exercise. So with the elbow directly under the shoulder, your knee slightly bent ahead of your pelvis, you're lifting through your lower waist, so you're opening out the bellows and taking care of your head alignment. So again, you're not maintaining the head up position, that's not in the midline, nor is letting the head go. You want to be able to maintain it, and in itself that strengthens the neck, working against gravity. So with your side bend, you're reaching up and over through the arm, lifting through the pelvis, and that is a good way of starting to challenge not only the buttock area, but particularly the lower waist upwards to the shoulder. Of course, you do that on both sides. And if you notice a difference between the two sides, it may be that you can attribute that to some of your problem areas or your feeling of weakness or difference between sides. Then of course the obliques are another area to consider. Now a way to warm up the obliques would be to look at the hip twist exercise. So you can use your hip twist as a way of mobilising your spine and starting to energise the obliques, just to really wake them up. But then we need to do more with them. So generally we'd be in rest position, clasping hands behind our head, elbows into view, and then into some oblique curl. Now, as you might already know, we can progress this from rest position into a single tabletop. So you could keep the legs still and work across to each side, or you could work across to one side and repeat over and over. You could, of course, work to double tabletop, and again, either just work across to one side or alternate sides. And then you can add in a leg stretch as we start to progress towards our crisscross. Now, all of this is absolutely fine, providing you're familiar with this exercise and you know how to think about the sort of teaching points and the safe points with regards to undertaking it. If you're osteoporotic and you're familiar with the exercise, then it's okay to be doing it, providing you haven't had spinal fractures. But what you wouldn't do is try hundreds of them. So it's thinking around other ways that you might be able to energise your abdominals without doing the upwards curl. And variety is key with that. So it's okay to do some, but we shouldn't be doing masses of those. And there are other things that we can do besides. Now, when we're looking at the neck and alleviating tension in the neck, which is quite often the case, then it's best to sit on the hands with the palms upwards. The reason being that it resists the shoulders from lifting up and reducing the effectiveness of the stretch. So if, when you're ready, you just join me by lifting through your chest bone, looking ahead, and then looking across to one side, keeping your chin on a horizontal line, and then back to the centre. Doing that across the other side and then back to the centre. You can do that a few times, and then tilting your ear towards your shoulder and back up. And then what you ought to feel is a stretch on the side opposite to the way you're turning. So if you're turning to the left, you should feel it on the right and vice versa. If you're feeling it on the same side, then don't worry, continue. It might change as you do a few more of them, and it won't harm you, but it is an indication that there is a joint block, which might be something that gets better with practice, or you need our help with manual therapy to alleviate that and enable you to achieve stretch. You can progress those by assisting your stretch further. So if you sit on one hand to anchor the shoulder, and then use the other hand on the opposite cheek to turn the head, and just sustain that for 2 or 3 breath cycles. And then when you come back, take the same hand over the top of your head and assist into your side flexion, which again you can hold for a couple of breath cycles. You're assisting the head to move, you're not pulling it off, so nice and steady, but that may deepen the sense of stretch and lengthening, elongating through those tissues. So hopefully you've got a little bit more of an idea about what we're referring to when we discuss the lateral line. You have a few ideas on how you might like to start to work on strengthening where you think you may need more attention and practice. And if you know why it is you've got problems, then often you can really help to work it out. And if not, then we can do that with you as well. So thank you for listening. Until next time.